So as a parent, what do you watch for? What are the signs that we need to be on the lookout for?
So definitely concern about changes, any kind of changes in eating patterns, right? You want to be curious about that as a parent. Doesn't mean that it's bad necessarily, but you want to be curious about it and you want to keep your eye on it. Certainly if it gets to the point of any kind of mood changes, behavior changes, withdrawal from social engagements, not wanting to participate with friends, not wanting to go to certain restaurants, things like that, you're going to want to be concerned as a parent. And I think one of the other misconceptions is that, I think parents that see the extreme of an eating disorder think, well, that's not going to happen. But it kind of sneaks up on you because a lot of these behaviors, especially in our society, are pretty sanctioned and celebrated. And so I don't know a lot of parents personally who, if their 13 or 14-year-old came home and said, hey, Mom, I'm going to cut out sweets, would be upset about that. They're likely to encourage that. There's a healthy balance. And it's hard to know when it becomes off balance and when it kind of slips into a zone of compulsion and anxiety driven of, I can't do this or I can't fix that. So what I would say to parents is don't be afraid to ask a lot of questions. Don't be afraid to conjecture and be wrong. It's much better to conjecture and be wrong, because your child is either, if you're right, then your child's going to feel validated and safe to kind of share their concern. If you're wrong, they're going to correct you and they're going to talk to you. So either way, it's win-win.